You know, the science of it.
To make them look beautiful, like you say.
Yeah, you have to have an artistic vision. You have to have a vision of what you want, and then you have to have a particularness to want to make them right and symmetric and go through all those details of breast size, breast shape, asymmetry, chest wall asymmetry.
So how does a woman pick, and we're just about out of time and I want to get to those photos, how does somebody pick a breast surgeon?
Well, I think the one good way to do it is ask the anesthesiologist.
They know. Okay.
They see all the breast surgeons, so they get to do that.
You do other doctors' wives.
I do other doctors' wives. In fact,
even plastic surgeons go to you.
In the last couple of years, I've operated on 4 plastic surgeons in the area.
Okay. Your photos, what are we looking at there?
Okay. Well, the biggest misconception about breast surgery, you asked that before, is that I do big breasts. And see, that's the problem, is as women see one big breast, or a big round fake breast, and they notice that, and they think, oh, plastic surgeon, he did that big round fake breast. When actually, in reality, the vast majority of the breasts are small C's, natural, but you don't notice those. Those are the ones you don't notice.
Interesting, okay.
So that's the biggest misconception. And so, for example, like this is a typical patient that I do. She's 26 years old, she has an A-cup breast, she just wanted some more fullness, she didn't want to be big, she just wanted to...
Very natural, by the way.
Yeah, and you see you can't tell there's an implant. Yes, I do fake ones, but that's the minority. The majority are natural ones.
Okay.
So that's a picture of that. Here's another one. And this one, she has breastfed. She has 2 children. She has lost all her breast volume. She also had a little extra areolar tissue outside her normal areola, which I incorporated into the incision. Okay. You can see the incisions are well healed. You can't even see them. And you see that she had a fair amount of asymmetry.
You can't see the incisions. Very nice.
And it filled, she just lost volume. And you can see it on this view here. She just lost volume, and she just wanted to get back.
So she's happier now.
What
you
she
say they wear
had
bathing
before.
suits, dresses now.
Absolutely. And then, you know, some people want, this is a medium C. These are small C's. This is a medium C. And this is, she wanted a little fuller breast. She wanted to be more proportionate to her body. And she wanted a little bit fullness on the top. So that person had that. And these are the kinds of things, by using different style implants and then communicating with the patient, we can achieve whatever result they really want. And you can see in her, pretty typical here, no tan. Afterwards, she has a tan line. We see that all the time, because now they're excited about wearing bikinis. And you know what? I can't tell you how many times after doing breast surgery it's changed their life.
Do they bring in a partner, by the way, with them on the consult? Is that
a lot of times they bring husbands and boyfriends, and you know, sometimes some of these women, they get so much more confident that the bad boyfriend, they get rid of him.
Is that right?
I love to see that.
Okay.
But you know,
do you like when they bring in
I love it. Yeah, because you know, the more you can communicate, and a lot of times it's a communication between all parties. But the ultimate decisions in the person wearing the implants, and that's the woman.
All right. Okay. So we have time for probably 2 more, and that's what you have, right?
Well, yeah, I have a couple more, and some people need lifts. They just do, and putting an implant just won't do them justice. And this is a particular case where I was able to do the lift just through incision around the areola.
So what was going on before? This
is after having children.
Is this common, by the way?
And this is called a tubular breast, they are very common. And it's a little bit of droop and a big areola. And a lot of times I can do these tubular breasts.
So you reshape the nipple area.
Yeah, and you see how her breasts are kind of triangular, and so I use the implant to shape her breast and give her a rounder appearance. And look at her cleavage zone. Before, no cleavage. And this is something that women really want. They want cleavage. And you can look at her. Look how her body looks completely different. And in this particular case, I mean, she's so much more confident about everything about her life. I mean,
like in the side view,
it's amazing how a lot of women will just dress differently after having breast surgery. There's more proportion. They feel sexier. They feel more confident. And you know what? I see it. I see them light up, and that's really great for me.
Okay. Okay.
And this is the last one I'll show you. Is you know, this is what we call a lollipop lift. And if they have a little more droop.
Why is it called a lollipop?
Because it looks like a lollipop around the areola and down.
Oh, this is the incision you're
incision.
So this is a lift patient.
Right. And so she didn't want to be big. She wanted to be somewhere between a small and medium C, very natural. And you can see those incisions just aren't that visible. And
so this is what they're worried about?
That's what they're worried about.
Because I've seen pictures where it is a huge, you know, we've, you know, call them T-scars, things like that.
Yeah, well, I've eliminated the T-scar.
You've eliminated the T-scar?
Yeah, and the...
What does that mean, by the way, you've developed a procedure
to
lessen that?
The circumvertical lift has been around for a few years, and not many surgeons were trained in it, and it's something that's been a personal quest of mine. and I think not many surgeons in the
You
area.
feel like you
do that.
mastered it?
Yeah, absolutely.
So you're the lift guy in San Diego.
I would
if
say
had to
so.
say that.
I
Really?
would confidently say that.
Okay. So this right here, so this is really nothing to be afraid of. And you call it a lollipop scar?
A lollipop scar. Mm-hmm.
And downtime for these? They're out of work a couple of days,
The
5
lift
days?
adds 0 to the downtime.
Okay.
So it's the same as a breast augmentation. Most people feel good at 3 or 4 days. I tell people they can be back at work at 5 days.
5 days. Some people probably go to work anyway, whether you tell them
Yeah, that's
a couple
true.
of days. There's nothing. We do have one more. Time for one
Okay,
more.
well, this is just another example of a circumareolar. That's just around the areolar type lift and an implant. And you can see this, again, look at her cleavage zone. Again, significant improvement. Then look at her side view. See how she's deflated above her areola? And now you see how the fullness, how much her breasts look. And look at how just better proportion she
So
is.
this was a lift and...
A lift and an
And
implant.
what signifies a lift? I mean, what distinguishes a lift?
Elevating the breast or
But
elevating the
where are you
areola.
pulling it up? I mean, where are you hiding the incision, I guess is
The
my
incision's
question.
around the areola here. It goes all the way around the areola.
And you could create a lift that way.
Correct.
Okay. And do you think that's a misconception with women that don't want to get a lift because of this big, ugly scar?
Yeah, because, again, if you see one bad, ugly scar, you're freaked out about it. Same thing with facelift. I see one bad facelift,
Right.
and it negates 100 great ones.
Interesting.
That's it. And these scars, I would say the vast majority of them, they heal great.
So
and
it's
the
not
patients
something
are
they
happy.
complain about.
No, it really
It's
isn't.
their incision.
No, they really
So
don't.
if somebody's thinking about a lift, don't be afraid of the incision.
Don't be afraid with the right surgeon.
All right, all right. Well, we're out of time. I want to thank you so much for coming on the show. All of these photos are on your website.
Yes,
All right, and you still meet one-on-one with your patients.
absolutely.
All right, okay. Well, thanks.
Randy,
Thanks
thank you
again.
very much. It was a pleasure.
All right. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this again online or direct a friend to it, you can visit our website at wellnesshour.com. You'll probably have this on your website as well.
Absolutely.
Okay. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.